I'm often asked by patients, how do I prevent skin cancer? Many of them have come in with a lesion or a growth, and either they've had skin cancer or they're very concerned about it, or a family history of it. And so certainly I think number one is awareness, regular screenings, regular examinations, especially if you've had skin cancer before or you have a family history that raises your risk of developing skin cancer. There are unique scenarios such as immunosuppression. Some people are on medications that are to treat either an autoimmune condition they have, or potentially they've had some kind of a transplant and they have to take medication, and they have to have regular screenings to make sure that they don't develop skin lesions. Certainly the second most important thing is preventing risk factors, and the biggest one is the sun. There have been studies to show that sunscreen helps prevent skin cancer, and there have been studies to show that people who regularly use sunscreen still have an incidence of skin cancer. And so a lot of those can be very confusing to people. Should I wear sunscreen or not in prevention? Should I try to avoid the sun? Those studies are often skewed because of the bias towards people who maybe spend a lot of time in the sun and maybe don't always necessarily use the sunscreen that they reported. So I think in general it's fairly well accepted that sunscreen in peak hours of the day when you're very exposed to sun for a prolonged period of time, more than 15 to 20 minutes. And then certainly we've noted that people are at a high risk of skin cancer if they have several sunburns in their life or multiple sunburns before the age of 16. So I think taking care that your kids don't have sunburns and that you don't leave yourself unprotected developing a sunburn. But in general, avoiding the sun. The last thing is age. Age is a big risk factor, and we can't really control that one. But we can control the screening and the examination, paying attention to that mole or that lesion that seems to have changed, listening to your loved one when they say, I think that looks different, and getting it checked out. And so these are the most preventative things. There is one other very important thing to mention, which is indoor tanning booths. In general, indoor tanning booths have been linked with cancer. In fact, the World Health Organization has stated that it is a type 1 carcinogen, which is their highest ranking. And they did studies in Sweden that showed that young ladies who did tanning booths had direct correlation with their development of skin cancer. So I think not putting yourself in harm's way, that suntan that you want before the summer comes may not be best suited in a tanning booth. In fact, some states actually have made tanning booths illegal under the age of 18. So I would recommend avoiding those. So in general, prevention is the best way, and screening is the best way to make sure you don't get caught with a lesion that wasn't treated.